And we are live. Hello, tribers. Can you see us? Can you hear us? Please let me know in the comments if we are audible and visible to you. Okay, great. Without any further ado, let's begin with today's session. The topic for today's session is rigorous workout in pregnancy. And for this session, we have with us Dr. Arvin Kaur. Dr. Arvin Kaur is a Guru Nanak Dev University position holder, second plus fifth. Did her bachelor's in physiotherapy, 4.5 years from APJ College of Fine Arts, Jalandhar. She has rich experience of 10 years in the field of physiotherapy at Mother and Child Hospital and specializes in antenatal exercises, postnatal exercises, labor pain management, natural birthing, breastfeeding, pregnancy discomforts, baby care, and postnatal care for mothers. Welcome to the session, Doctor.
Thank you so much. Thank you so much for having me here, Dr. Shweta. It's definitely an honor to be a part of this video and being live for such a beautiful audience. So,
Doctor, any opening thoughts for the session?
Sorry?
Any opening thoughts for the session?
Opening thoughts, it's just that I want to enlighten some beautiful tips through which we can clear the dilemma of labor pains, how we can manage the labor pains, the fear of labor pains, which is, which is dragging us away from normal vaginal births these days. So today's framework of the topic is going to be all around this particular thing because it's something which everybody needs to know that it's not that painful the way we think or the way we tend to hear from people. Okay, so negative thoughts they spread over, or negative feedbacks they spread over much more faster than the positive ones. But I need to enlighten some positive things about natural birthing today. So for that reason, we have to work out, which our mamas and grandmothers used to do out of no reason. They used to work everything in Scots manner. They used to do all the households in the Scots manner. But we are sailing in two boats, right? We are taking care of the households also, and we are earning also. So we are lacking somewhere that physical workout, which can be achieved through all these physical and mental preparations for a normal vaginal birth. Okay, so we're going to talk about rigorous exercises for pregnancy today.
Okay, great. So, Doctor, what are the key considerations for implementing a rigorous workout routine during pregnancy?
Basically, the most important thing is that we need to take care of one simple fact that this is not a disease. We need to enjoy, we need to have the most beautiful experience ever with us, as this is the most joyful period, right? A new bud is growing in our body, and we have to make sure that we are giving the most beautiful blood supply to the baby. We are way more comfortable with our body. We are having enough of water. We are sleeping well. We're taking the most healthiest diet. So the key considerations for exercises during pregnancy is to make sure that you're very much positive about it. That is, that it is going to increase the circulation in your body, which is going to help you to process each and every organ working. Like during pregnancy, the hormones, they play a major role. They tend to decrease the activity of every organ to 50%. But if we are exercising every day, we are making them work in a way more faster manner. So that is how we can bring up good amount of growth for the baby. That is the positive thought which we have to keep in our mind, that will keep us active, it'll keep us discomfort free, it'll give good growth to our baby, it'll give us comfortable sleep, it'll give us good digestion to whatever we are eating. So all those considerations should be there in your mind, only then you can be positive about exercises. Because what does elder says कि घर का काम कर लो तो exercise ही होता है. It's not like that, right? We need to know the fact that every joint needs to be moved nicely. Every part of the body needs to have good circulation. It's not just that we are just walking around and it is done. No. We're just doing the household chores, it's done. No. We need to have good strength with the back to hold the growing weight of the baby bump. We need to have that flexibility in our body through which we can aim of having a very ease while internal examinations or pushing stage at natural birthing. So all these things are pre-prepared, through these exercise protocols.
Right. And doctor, can you provide some examples of exercises that are considered safe and effective for pregnant women?
Okay, I will definitely love to enlist few of them, which is very important. That is the ROM exercises. ROM means range of motion exercises in which we are attaining full range of every joint. The reason being there are relaxin hormones which release in our body targeting the hip section because the baby has to grow there, right? The pelvic floor, the uterus, it is going to grow in size, the baby is going to gain weight, and the hips has to lose their strength, or you can say the strength which they are holding the hip joint. It has to get laxed out. For that reason, relaxin hormones are released in our body to make sure that they are not holding the joints too tight and they're easing out so that there can be a space created for the baby. But unfortunately, that hormone is released in the blood, which actually laxes all the joints in the body. So, what is happening? We feel fatigue. We feel fatigue and we don't feel like doing anything. The joints, they become stiff. And when stiffness is there, the pain will arise. So when you move every joint in full range of motion, the things work very beautifully. So the girls who have in certain cases, कईयों को, the doctor is recommending bed rest, for example, placenta previa is there, cervical sclerage is there. In those cases, we just make sure that they're doing the warm-up regimes, the ROM, the range of motion exercises, so that they're not getting any kind of stiffness in any joint of the body. And then slowly and steadily with the second trimester onwards, we focus on the strengthening part, which ensures when the baby bump is going to grow, your back is having good amount of strength. Then in 8th and 9th month, we focus all on stretchings because we need to know that yes, only squats, that is the Indian toilet position, is going to help us to make sure that the baby is in right position for a vaginal birth, and it is going to help us to create that flexibility with the legs, which we need at the time of labor pains while pushing stage. Okay, so it's like warm up, then the strengthening part, stretching, and then the squats and duck walking, everything which we target in late ninth month. So it is a step-by-step protocol. It's not that you're coming up in ninth month and you're saying, "Ma'am, please let me know what all exercises are supposed to be done. My due date is near." So it's not going to help you for sure. Of course, we never give up. We give our best regime whenever my student turns up in whichever week it is. But it's for sure required to know. Every pregnant girl needs to know from 14th week onwards, we need to start with exercises. It has to be very mild, then moderate, and then with max effort, which we target. It's not that you're coming up for the first day and I'm giving you all of that whole regime of 1 hour on the first day. It's not going to happen like that. It just 10 to 15 minutes regime, and slowly and steadily we increase the time with addition of exercises from 6th month onwards, and we make sure that every week one addition is there so that our body is getting used to all those exercises. So
Right.
that is what we keep in our mind.
Okay. Doctor, how does the intensity of a workout impact the mother and baby during pregnancy? I mean, you've just
Oh,
answered majority of it, but if you could please add more to this question.
the answer is good amount of circulation. The answer is good amount of digestion. Whatever you're eating, if it is getting digested nicely, it is going to bring up all those restoration of the, carbs, then the proteins and the fats and the nutrients. Everything is going to get filled up inside our body only if it is going to get digested nicely. And how digestion is going to get possible? Only through exercises. So if you want to give the most beautiful growth to your child, you need to exercise every day,
Lovely.
right?
We do have some viewers' questions. Let's take those up and then go back to some other questions. Should we doing exercise avoid during first trimester? Should we avoid doing exercise during first trimester?
Okay, since we have so many, you can say variation of symptoms. It's not like every girl is getting nausea. It's not like every girl is getting vomitings. If some girls are like, "Ma'am, मुझे पता ही नहीं चला मेरा first trimester कैसा निकला," and they're enjoying it very nicely. So in that case, of course, you should keep walking and you should start with some mild exercises. For example, ankle toe pumps, hand pumps, Kegels, but not the stretching ones, right? Not the strengthening ones. But actually, ideally, when you're having nausea and vomitings, you should ideally frame your mind that you just need to fill up your energy levels with good amount of hydration and not thinking about to exercise. Right? What to eat and what not to eat is a biggest task in first trimester for those who are facing of nausea. So as such, we start by 14th week. That is your fourth month onwards. That's the perfect time to start with exercises. Before that, you can definitely focus on pre and post meal walk, which will help you a lot. That actually makes really good difference in your digestion power and helps you to deal with other symptoms as well.
Great. Okay. If we had a C-section during a first pregnancy, is it possible to give a vaginal birth during the second one?
Yes, of course, but there are certain conditions applied. We term that as VBAC, that is vaginal birth after C-section. Okay, VBAC, VBAC. Okay, so criteria or the condition which is required is that there should be a gap of 5 years between two pregnancies, and when we are having second pregnancy, we should all uh, be prepared with the physical and mental strength to have a natural laboring process. We cannot induce you. It's just that with natural pains, we can have a vaginal birth post C-section. That is something which we should aim for, that we should prepare our body accordingly. We should be doing squats from 35th week onwards so that we are heading towards natural vaginal birth nicely. So for that reason, again, you'll have to see me for sure to do start up with the exercises as soon as possible. So two criteria, the gap of 5 years and the pains has to come naturally. Because if we will induce, then the scar which is there already, it might get chances to get, you can say, harm with induction, because the pains which we give in artificial induction, that is the hormones which has to release naturally, we are introducing them artificially, right? So if they're going to give it artificially, the pains are going to come in an uncertain manner. They are little stronger and intense pains, so it can harm your stitch line. That is why we cannot induce you. The pains has to be natural.
Okay. How can pregnant women monitor their exertion levels to ensure that they are not overdoing a
They should
workout?
not feel breathless. They should not have shortness of breath, of course. You know, we need to know that where is the line. We need, there's a golden tip which I always give to my students, that always keep one thing in your mind, that every 30 minutes you have to change your position. If you were sitting, just walk around. If you're just exerting yourself in the kitchen, just sit down, have some good nice short meal, or just lie down for half an hour, have a good nap. But you should not exert yourself too much. You have to be active but not exertion. You should not exhaust yourself basically. So
Right.
when you feel shortness of breath is there, when you feel you have a little bit of pain in your feet, of course the things should cut down and you should relax.
Okay, great. How do mental and emotional well-being factor into maintaining a rigorous workout routine during pregnancy? And what strategies can be employed to support the overall wellness of a pregnant woman?
Oh, you won't believe, Dr. Shweta, my students, they feel so beautiful once they start doing exercises. Within a week, they say, Ma'am, we are addictive to it like anything. They feel so good about it. They feel so confident with their walk. They feel so good to actively participate in the household chores with which they were, doing it without any interest or without any love. They start feeling that, feeling of well-being, that yes, it is not a disease. We have to enjoy it. They start planning over where we have to go, where we have to, what all things we have to plan. The concern becomes different. First, when they entered with the concern is, "Ma'am, मुझे यहाँ pain है, मुझे वहाँ pain है, ये कैसे जाएगा?" And the moment they get relief, they feel so good about it. So I assure you, the moment you start with the regime, of course, we start with any physical activity. It takes around 2 to 3 days or maybe 4 days to get get comfortable with what you're doing, right? If we start with any physical activity, the moment you get comfortable, like maximum of 2 weeks, if you're doing it, pushing yourself for 2 weeks, you're continuously maintaining a routine, I assure you that a pregnant girl loves it and gets addicted to it. She cannot make her day without that, for sure. I can promise for that reason. Okay? Because we are not giving any high strenuous exercises. They are very mild and making you way more comfortable rather than giving you exhaustion or exertion, right? So you can do it in any hour of the day. It's not that precisely you have to do it in the morning or in the evening. They're going to relax you down. Even the girls who are like working, they are working from 9 to 5. They come back home and they join us by 6 p.m. and they're so happy. It's like, ma'am, सारे दिन की थकावट खत्म हो गई यार. It was so good. So this is what we aim for, to giving them the most beautiful and comfortable pregnancy journey. That's the aim for exercises during pregnancy.
Right. We have a viewer's question. What should be the interval or the time duration that a pregnant woman to do exercise? Duration between exercising sessions.
Okay, so generally we just recommend exercise regime to be done just once a day. Okay, we have a particular regime which should be done once a day. Post 1 hour of your meal. If you're taking any meal, 1 hour ka gap hona chahiye. Or ensure karna hai that you have eaten something half an hour to 45 minutes before the exercise regime, because you cannot even exercise empty stomach also. You will start feeling that energy levels are drooping down, or you're feeling breathless, or palpitations are there. So you need to fill up your energy levels, and after that half an hour or 45 minutes gap, you can start exercises. Okay, so once a day we tell you to go for a full-fledged regime, which starts up from 14th week, around 15 to 20 minutes of regime, and then slowly and steadily it increases with 5 minutes every week. So it comes down to like not exactly 5 minutes, maybe 3 to 4 minutes. And when you are there in the ninth month, you tend to go for 50 minutes to 1 hour regime without without feeling tired or without getting any kind of shortness of breath or palpitations. I can assure you for that, because your body gets used to it, right? So that's something which gives you a very good confidence to face
Right.
off the labor room with a big smile. The rest I'm all ready.
Yes. Doctor, any points that we've missed out and we should be discussing in this session?
I just have to mention one thing, that these sessions, like not just the exercise part, the mental preparation is also very important. Okay, there are so many questions which a doctor, you want to ask to the doctor, but you're not comfortable enough, right? You feel like that, I wish I could have stayed 5 minutes more and I would have asked these questions. For that reason, I'm here. I'm here to talk your heart out. Okay? We need to discuss our feelings, or discuss our queries, or discuss our guidelines. What is supposed to be done? What is the right kind of guidance which we need during pregnancy, or during childbirth, or during post delivery as well? It's not that there are less of concerns post delivery. There are so many. You won't believe, so many things to talk about post delivery. So when if you want to make all these three phases way more comfortable, you need to see a physiotherapist or a pregnancy coach, and I'm there to give you the best services. Okay, so exercises, they're gonna help you a lot, a lot, a lot. Please make sure that you're exercising every day, because this is not gonna make you feel tired. They're gonna make you feel way more energetic. I assure you.
Okay.
And they're gonna help you for the post delivery phase also, right? It's
Yes.
not that the moment you deliver everything is going to shed off. No, that energy, that strength, that flexibility is going to get transferred for the post delivery phase as well. So it's gonna be wonderful recovery phase as well. You feel way
Right.
more confident.
Right. If someone wants to start exercise in her 8th month of pregnancy, then can they start now, and by what timing or duration?
Yes, they can start. We have a protocol for that. Reason being, it's not that you are late, but whenever you are coming up, we have a different protocol for the same thing. Fine. So it's not that you coming in your 8th month and I'll give you all the exercises which we start up from 14th week till 8th month. मैं वो सब नहीं दूंगी. I will start with the warm up. I'll start with that 4th month regime for few days, 3-4 days, and then I'll slowly be adding all the strengthening and the stretching exercises within 15 days of time span. So that when you come up, you start up with 15 minutes of regime, and within 15 days you will be reaching out 35 or 40 minutes regime. So slowly and steadily you'll be giving you additions. So it can be planned accordingly. So it's never late to exercise. Point is that.
Great. Lovely. Any closing thoughts for the session today, doctor?
Just that, please make sure, try to make your pregnancy journey the most beautiful and memorable one by keeping yourself active, dressing up beautifully every day, and not feeling that you cannot do this or you cannot do that. You can do everything in pregnancy you were doing before pregnancy period. You can eat everything, whatever you want to. It's just that the quantity and the cooking style has to be a little different. That's all. Plus, fear out that thing of the dilemma that labor pains are hell, very painful, or we cannot bear that. We have the same system as our mothers or grandmothers are inherited with. We are not lacking anywhere. It's just that the right kind of guidance, how to prepare yourself for natural birthing, is required. So come and enroll for in Lamaze sessions with Motherhood Hospital.
Lovely. Thank you so much for such an insightful session and sharing all this valuable information with all us
Pleasure
drivers.
is all mine, Dr. Shweta. Pleasure is all mine. Thank you for having me. It was an honor to be here.
Thank you once again. And thank you so much, drivers, for tuning in. With that, it's a wrap on today's session. Stay tuned for more such interesting sessions just on Parent Tribe by SuperBottoms. Bye-bye.
Thank you. Thank you, everyone, for being there, listening to us with full patience. All right. Bye-bye. See you next time.